Hi, I'm Dr. Cindy Collins. I am a registered dietitian and a health psychologist working in oncology. Relationships during cancer, like every other time of your life, are really important, but they can especially be important for certain reasons when you're going through cancer treatment and when you're facing a challenge of cancer. So, the question many people ask is, well, which relationships will be helpful? Which one would be harmful? Much like the rest of life, some relationships are not really giving us what we need or supporting us in that time. And we're not always that great at knowing which are the better relationships. It's not that easy sometimes, except maybe in hindsight, to think about something being as a harmful relationship versus a helpful relationship. So I say what's most important is to go with your feelings. The feeling you have when you're engaging in that relationship, either in the moment or sometimes later, will tell you a lot. If being with somebody or speaking with somebody leaves you feeling stressed or feeling much more fatigued or spent or feeling saddened or feeling frustrated, it's probably not a helpful relationship. If makes you feel even angry or very upset about things, it might even be a harmful relationship. And it's good to be able to start heading these off at the pass, maybe looking for some of the red flags, I call them, or warning signs that a relationship isn't good for you. For example, relationships that support you, that give you what you need during a time of cancer, during a time of treatment, and the challenge of everything else that cancer brings, will feel supportive. You actually might feel supported by somebody saying things that are encouraging, saying things that are helpful, or saying nothing at all, but just being really good company. These are the relationships that ask you, what can I do for you today? What is some way that I can be helpful to you? What would you like me to do? Would you like a phone call? Or even when they call, saying right away, is this a good time? Is this a time where you feel like calling? Would you like me to call back if you're feeling too tired? These are supportive relationships that are first asking about your needs. That might feel a little bit selfish to some people, but this is a time where you do need to be a little more self focused. Even if you're a very helpful person, right now is not the time for you to be putting your energies and expending your time and your focus on other people necessarily. So let's talk about that kind of relationship, a relationship that is taking a lot from you, that actually is where you encounter a person who is needy in a way, for example, for you to agree with everything that they're asking you to do for your cancer. I think we've all bumped up against those individuals. Or maybe these are relationships that need you to see things the way they see it. Maybe they feel that you need to do something different with your treatment, see a different doctor. They're really serious in trying to enforce that you eat certain things or do other things for your lifestyle. Those aren't necessarily helpful relationships because these are decisions that you need to make for yourself. So if you find yourself needing to satisfy them or needing to please them, or needing to spend your time and your energy on their needs, that probably is not a good relationship. So, a relationship that tears you down or causes you to feel concerned or less trusting of your own decision making, less trusting of your doctor and your medical team, that's not a good relationship. Not that you can't entertain other ideas and consider them, but only to the point where you check something out and then everyone is good with your decision and they honor and respect your decision. So many times, a lot of patients find that they have to switch their behavior a little bit because they're used to pleasing others or used to just being a really good caregiver, and that's not serving them well anymore. A good way to watch yourself for this is to remember that when you are through treatment and when you're no longer in the throngs of being a really good patient and having to care for yourself so much, you'll find that you have leftover energy or leftover feelings of attention and things that you can give to others. You'll know that. You'll know that I'm so good now. I feel so good and I feel like I've recovered. I'm doing so well after treatment that I actually have energy. I have the interest, the motivation to now turn my attention again toward others and give them more of what my resources are. At that time, you know that you're a survivor, that you're doing well, and you can then start caring for others, even other patients. You'll find yourself giving advice. You'll find yourself saying, would you like to sit down and talk? Would you like to have a coffee? Would you like to take a walk? That's at a time when you know you have excess energy, excess resources. But when you're going through treatment, be very careful that you're with relationships that aren't taking the energy that you need for yourself. So, is it possible then to put some relationships aside, at least for a short period while you're going through chemo or through other treatments? It is. And talk to other patients. They will talk to you about how they made a decision on how to prioritize their relationships. Not that they couldn't resume some later, but some are less helpful while you're going through treatment.